Dr. Carla here in Rome with beach volleyball. We're going to talk about some of the conditions that I might treat in the clinic, and what better joint to start with would be than the shoulder, because I'm at a beach volleyball event. So I would consider myself the garbage disposal for shoulder issues in the FM area, meaning if you've failed other types of therapy, people usually find their way towards me. So let's talk about some conditions that I can treat and that we can do conservatively and you can have really good outcomes for. So rotator cuff tears. It's a rotator cuff, not a cup. It consists of four muscles: your supraspinatus, infraspinatus, teres minor, and subscapularis. And then I'm going to loop in your long head of your biceps tendon as sort of part of that. So that is something that we can definitely care for. Shoulder instability is another big one, and I love shoulder instability work because it gives me a chance to really hit up hard on some rehab. Scapular dyskinesis, which means that your shoulder blade isn't moving in the right rhythm for your shoulder to operate at a high level. And if this happens, then your rotator cuff is going to be injured at some point. Thoracic kyphosis, which means that my upper back is rounded forward a lot, which doesn't allow my shoulder blade or my shoulder to move well. And so if we don't have a thoracic spine that moves very well, your shoulder will be dysfunctional. Biceps tendonitis is another big one we see. Usually is a result of a dysfunctional shoulder. And then an odd one, but I've seen it a couple times lately, is a suprascapular nerve impingement. So it's a nerve that comes out of your scapula that becomes pinched, and it makes some of your rotator cuff atrophy and kind of die off. So these are just some of the shoulder conditions that I treat in the office. I do that by any type of adjusting or myofascial work or instrument-assisted work, and I can also incorporate acupuncture and dry needling, all before we get into your rehab regimen. And one thing I would ask you if you're currently doing rehab with your shoulder is it moving you in the direction that you need to be healthy and to reach your goals? The one thing I see a lot of providers not do is not ask the patient's goals, because my goal is going to be different than your goal. So I would recommend making sure that you're moving towards your goals in your rehab regimen. That's all I got for today.